Good morning. So it's another appointment day. I have two appointments today. One is with my nurse, just for a checkup, see how I'm doing. And the other one's with my nutritionist. So we're going to see how I'm eating. I know I'm not eating great. It's not enough calories, but he'll yell at me. So yeah, I'll try and sneak you in as usual for the weigh-in number, and we'll see you shortly. Bye. Alright, so here we go to have another weigh-in. I know you guys have anxiously been waiting. I haven't been back to the clinic for a little while, so here we go. And so that's in kilograms, 103.5. And for those of you that don't like the conversion, 228.1. I started at 297.3, I think it was. Hi, so I'm back. We did the little weigh-in of what I managed to get you in to see the scale. So I saw both the nurse. It's not my normal nurse. I have a new one. Very nice lady. So it wasn't the one I'm used to. We discussed how I'm feeling, my energy levels, discussed how much I exercise, so the standard of discussions. And then I saw my nutritionist, who has given me some direction, of course, as always, ever to be counted on. So some of so I'm still only averaging 500 to 600 calories a day, which is still not. At this point of my surgery, of my pre-op, they say I should be able to manage 8 to 1,000, and it's still 5 to 6 if I'm lucky. So we are looking at, so I take a calcium supplement. So the supplements I take are iron, I take a prenatal vitamin, I take a vitamin D, and I take a vitamin B, and then there's a calcium citrate. It's very important for people after surgery to have citrate, not just regular calcium, because we can't break it down and digest. So he asked that I increase my calcium supplement from 1 tablet a day to having 2, which is 1,200 to 1,500. Yeah, that's a lot of calcium, but apparently we need it. So it would be 500 milligrams 3 times a day to make it easier for me to deal with. And then discontinuing the vitamin B. So the vitamin B complex I was taking myself because I found that it improved my mood, it improved how I was feeling, improved my energy level. He said I'm probably getting enough of the vitamin B out of the prenatal vitamins that I have to take. So in order to compensate for the additional calcium, to remove the vitamin B. So plan to incorporate 3 meals and 2 to 3 snacks a day. So currently, because I'm only eating 500, so he's asked me to try to incorporate 3 meals plus 2 to 3 snacks per day. Obviously, since I'm only eating about 500 calories a day, I'm not meeting that. I'm not eating full 3 meals. I'm not eating 2 snacks. I'm doing what I can, and he understands that. We discussed how I feel full. It's about the size. Does this mean anything to you? So my meals are about 3 fingers. So that's about my entire meal. That's my protein, my vegetable, and my grains, if I eat the grains. So it's not a lot of food. It's not sustainable. So I've been trying to eat all day long, trying to get my snack, because I thought that would work better. But then he's worried that that'll create a habit later on when my stomach is better, to me grazing. So, and that makes total sense. So gonna try and do 3 meals and 2 to 3 meals a day. Focus on meals and avoid distractions. Chew your food thoroughly. So I already chew my food thoroughly, but he puts that on whenever he mentions anything to do about eating. Distractions. So I do tend to work, like when I'm at work, I do tend to be at my desk and read my emails and do work while I'm eating. I very rarely go to sit and eat my meal. Same thing with my breakfast, because I don't eat breakfast before I leave the house in the morning. I typically eat my breakfast at work. And again, it's while I'm reading my emails and, you know, whatever the case may be. Supper time is dedicated family time, so I sit at the table and have dinner with my family. So a little more focused on my food then, but and on weekends a little more focused. But during the work week, no. So I'm gonna have to work on actually leaving my desk and eating somewhere and focusing on my food and taking 20 to 30 minutes per meal. I take longer. I eat 40 minutes, 50 minutes, and I said that is way too long. So I need to try and get my food in 20 to 30 minutes. I'm taking too long to eat it. And then after 30 minutes, just stop eating. It doesn't matter if I've eaten at all, because that's part of my problem of making me sick is I'm very concerned. I'm thinking about it all the time. I haven't got my calories today. I haven't got my protein. I haven't gotten, you know, I haven't met my goals. So I choke it down. I make myself do it. And all I'm doing is making myself sick. And ultimately, it's a detriment. Continue your, really, like the writing. Really. Continue to focus on your protein intake and target 800 to 1,000 calories today, to $1,000 calories per day. So, like I said, I'm about 5. Sometimes I can get 600 calories in a day, and he'd like me to go for 8 to 1,000. So I'll definitely work on that. Something else they're asking me to do, and this is quite normal. I'm actually a little bit late. They usually ask for this sooner. I'm about 5.5 months, maybe 6 months out from surgery. My surgery was September 22nd. So, they've asked for me to have blood work done to check my blood pressure. No, my blood pressure. To check for my iron levels and just vitamins and that kind of thing. Glucose, you know, so I have, you know, my levels. I have to fast for 12 hours, not a problem. So they're just asking for, you know, basically my vitamins and minerals to make sure that my body's okay. I am wholeheartedly expecting to see my iron come back as crappy, because it always does. I think in one of my first videos when they did it, they were, you know, they asked me if I was vegan, and I'm not, because my iron was so low. So I'll probably get the same again. So yeah, other than that, I seem to be doing better. My energy's a little bit better, even though my calories aren't great. I need to start doing videos somewhere else, because I went back and started watching some of my other videos, and I don't look any different maybe in the face, but because I'm always wearing my big jacket and I'm behind the steering wheel, I definitely don't look much different because of the clothing. But doesn't matter. I know it's different. I'd really like to thank you guys for watching the videos and for supporting me, and I hope that these help you. If you have any questions that you want to ask, nothing's taboo to me. I'll answer anything you ask related to surgery, related to anything to do with the surgery. So whether it be personal or whether it be the procedure and before and after. Yeah. So to you trolls out there, we're not answering what color my hoo-ha is. That's not going to happen. Yeah, that was a long rant for nothing. So please rate, comment, and subscribe. You can click the link down below. So as I said, I did sneak you in for my weigh-in. So my starting weight was, and my mid-range weight was, and now my weight today is, so that's quite the difference. I'll do it in kilograms as well over here so that you can see the kilograms, if that's how you do your weigh-ins, if that's how you're comfortable doing your measurements. So that's great. I'm really happy with my progress. I didn't expect a magic wand. I didn't expect to be a supermodel. Well, I was already a supermodel, but I didn't expect to be a skinny supermodel the day of the surgery. So realistic expectations are key. So yeah, thanks so much for watching, and remember, motivation is a choice, not a feeling. Bye guys.